This is Jose Merino, Editor-in-Chief of the Neurology family of journals. The Neurology podcast provides practical information to neurologists and other clinicians to help them provide better care for their patients. Thanks for listening and have a great week.
Hi, this is Jeff Burns from the University of Kansas Alzheimer's Disease Research Center. Today I'm interviewing Natalia Rost from Mass General Hospital to discuss the AAN's platform and position statement on brain health called The Brain Health Imperative in the 21st Century, a Call to Action. Welcome, Natalia.
Thank you.
I'm really excited about this position statement. I think it's inspiring. I think it's timely. Yes, it's lofty, but I do think it will ultimately help us move things forward in a more integrative and a multidisciplinary world that's focused on the brain health idea. And I think this is something we need. So I thank you and I thank the committee and the AAN for pushing this initiative forward.
Thank you, Jeff. And also a big shout out to my colleagues, particularly David Evans and the AAN's Committee on Public Engagement, or COPE, and the AAN staff team supporting the Brain Health Initiative, just because they've been absolutely through and through with us every step of the way.
Let's start with you giving us a big picture take on what this is and what the committee was trying to achieve.
This position statement is exactly what it sounds to be. Brain health, the imperative of our times, really, with neuroscience being the last remaining frontier as we unlock the mystery of the human brain, so to speak. And it's also a call to action on this topic of paramount importance, and us neurologists envisioning the future of brain health for everyone and convening the entire field of our colleagues, other subspecialties, but also allied professionals, government agencies, legislators, and more importantly, the public in support of this initiative, whether through the grassroots patient advocacy or championing policy change for communities, small and large, and for the benefit of everyone, really, now and in the future.
Great. Well, I think I'm right about 20 years into my career, and I've observed throughout this evolution in the ideas about brain health and a move from treating disease to one in which we are now thinking about prevention and promoting brain health. And I think things like Alzheimer's disease exemplifies this, where we're starting to think about recognizing risk and looking for changes of Alzheimer's in the brain before symptoms and going after it. It's not something we're doing yet, but it's on the horizon, we believe. And so let's talk about the timing of this. Why now?
Simply speaking, the timing is right because of the growing interest in individuals, young and old, in health and well-being right now. But we also, on the other hand, can no longer delay this movement, right? Because of the general state of the population health. And if the recent pandemic taught us anything, an optimal state of health is a very fragile concept, right? Just look how, for the first time in decades, the average life expectancy actually declined for both men and women in the United States, and how the mental health crisis has deepened for all segments of the population. And who is yet to tell us what's to come for the health-related pandemic aftermath? So all of that constitutes the urgency. But on the other hand, we are entering one of the most exciting times in neurology. As you know, myself and you being in practice for years, now with all the diagnostics and treatment options growing exponentially for nearly all aspects of brain disease, including genetic diseases, brain inflammation, stroke, epilepsy, and even Alzheimer's, as you mentioned. But all of these treatments and disability related to brain and neurological disease really translate into enormous healthcare costs. So we have to ask ourselves, what if we had a solid plan of preventing these diseases rather than playing catch up on this havoc that they ultimately wreak? And so that's where the concept of brain health comes in.
I've always liked the term brain health because it's broad and it does focus on health as opposed to disease, but it gets criticized as being, nebulous, despite the fact that it's being increasingly used. So this report of yours and the committees, you do talk about definition of brain health. How did you define it?
So that was one of our key priorities. And you're right about the terminology and how complex of a construct brain health is. For years, there were as many definitions as there were attempts to get at it, so to speak, from its multiple angles, like the proverbial elephant in the dark room. Everybody gets to say what it is, but only based on what they know about it. And so this was going in circles, like a self-fulfilling prophecy, really. But one of the strategic objectives of the AAN's Brain Health Initiative was to derive a definition of brain health as a neurological concept by neurologists, so to speak, and for neurologists. And so we did this through a series of consensus building exercises involving dozens of brain health experts inside and outside of the American Academy of Neurology, led by Joel Salinas of the Committee on Public Engagement. And as a result, we arrived at the definition included in the position statement, of which I am particularly proud of. And it reads as: brain health is a continuous state of attaining and maintaining the optimal neurologic function that best supports one's physical, mental, and social well-being through every stage of life. Now, every word in this definition is like a facet of a precious stone to me. It's been poured over and over it. And only the ones that passed the consensus, so to speak, test made into the definition. And it wasn't an easy process. And as you can imagine, there are as many options as experts out there, and it had to be perfect in some way. Not too perfect, not too short, not too long, not too general, not too detailed, not too pragmatic, not too theoretical, right? So very complicated process. But in the end, we realized as a group that it cannot be perfect, but it reflects the current expert consensus on what brain health is. And most importantly, we left the door open on revisiting and revising the definition as evidence evolves along with the consensus. So if you think about it, it kind of hits on all the key points of a definition. So first, brain health is a state. It's a continuous state of attaining or getting to and maintaining or holding onto the optimal neurologic function, meaning that this is the function that reflects best you can be and the one that best supports one's physical, mental, and social well-being. All three elements are crucially important for the function of the brain, right? And finally, through every stage of life is a very key point of the definition, because most of the prior work, not all of it, kind of focused on the continuum of life and brain health. But the Academy's proposed framework on individual brain health specifically defines these brain health epochs. And those epochs are focused on particular brain health goals. For example, fetal and child development, or adolescent and youth, or adulthood, or maturity and senescence, which, by the way, we elegantly termed it platinum years. These are all epochs that deliberately not defined by specific ages, because we don't believe in chronological age cutoffs being biological age representation. That's actually even seen in some of the scientific work that we do in my laboratory. But those epochs help us carry out the plan to achieve brain health for different population segments.
Great. So in addition to a definition for brain health, you also provide goals and a vision for brain health for the year 2050. So looking forward, tell us a little bit about what are the goals and what is the vision for 2050?
An important difference at the core of the AAN's position statement on brain health is that we wanted to be strategic about the future we're bringing about. But strategy is only as good as the means of getting to one's envisioned future. So this work really turned into an incredible opportunity to paint, so to speak, this future, to predict, project, and to forecast what future we should aspire to, and if we were to be serious about changing it. And so for the first time in our position statement, we present this future of brain health for all as part of the AAN's Brain Health Platform, which also has a component of AAN's positions on brain health and also AAN's 3 ambitious brain health goals. I wanted to mention these 3 goals. 1 is to accelerate scientific discovery in brain health. 2 is optimize brain health through integration of preventive care practices. And 3 is to enhance public and patient engagement to advance public policy for brain health, because they are aligned with the pillars of the AAN's Brain Health Initiative, which are science, patient care, and public policy. If any organization can leverage the power of brain science, patient care, and advocacy, it's the AAN. And regarding the vision itself, which is clearly outlined in the position statement, and I don't have to go in detail through all the elements of the article, we can just highlight that the important part was to include all the aspects of what the future could include. For example, accumulation of brain health science, growing the cross-disciplinary field of preventive neurology, developing evidence-based guidelines on brain health for all ages, codifying what we call a well-brain visit into routine clinical practice and making it a standard of care in the future, educating professionals and the public with trustworthy information around brain health. And all of these efforts being led by the National Brain Health Plan, which is kind of a pinnacle of our brain health vision, something similar to the National Alzheimer's Project Act, or NAPA, which would guide our research, care, and public engagement priorities. Can we get to this vision as a nation by 2050? I sincerely hope so, and we're already making solid strides. As you know, Jeff, through the AAN's Brain Health Summit, which we commenced in 2022 and continued in 2023 with the theme of collaboration, we've convened nearly 150 stakeholders representing over 100 academic, practice, professional organizations, government agencies, industry, lawmakers, innovation sectors, and all of them are eager and willing to work with the AAN to move strategically toward our envisioned future of brain health for all.
Yes, it will take the science and the care and the policy efforts to really come together, but it will also take a more multidisciplinary and collaborative and integrative approach, as point out. And so this resonated with me because I've been working at the University of Kansas, the Alzheimer's Research Center, for the last at least 4 years on our own initiative to really start to break down the silos around Alzheimer's disease. And you can think of things like dementia are much more than Alzheimer's. So we need to bring in Parkinson's, we need to bring in stroke, we need to align our care pieces around those and integrate them better. So I see something like this position statement as a really nice catalyst that reinforces what we're doing in Kansas City as being important. And I know we're not alone in this effort to set a stage for this new era of brain health. And another way you do this is the call to action and the blueprint for the future of optimal brain health. So talk a little bit about that.
You're absolutely right, saying that there are already a lot of individual, organizational, and also professional society level activities are ongoing in this field. And my feeling is that it's going to take a village. It really is important that we all come together working on the same problem for us to actually make it into a transformative moonshot-like initiatives. And so, as you know, the AAN has a very long-standing track record of leadership on all things brain, so to speak. But among our competencies really are the science, patient care, and the advocacy. And so we knew entering the field with so many brain health stakeholders out there, from CDC or Centers for Disease Control to American Heart Association, from Alzheimer's Association to institutional brain health centers and Brain Health Institute. But most of them until now operated in silos, and so the impact was rather fragmented. And as brain specialists by trade and by convictions, I should say, neurologists are really, specifically the AAN, were very favorably positioned to become champions by convening all the stakeholders and convening all the collaborators to work together toward the optimal future of brain health for all. And so our call to action is truly a rallying cry to join the forces, to break the silos, to marshal the resources, and to coordinate the efforts on this. And from the very beginning, we summoned the experts for the lifespan EPOG work groups and charged them with developing the top line priorities, for example, based on each EPOG's goals for brain health, such as, let's say, develop a best possible foundation for the fetal and childhood development EPOG, or optimize quality of life, independence, and fulfillment for the senescence EPOG. And we focused on the 4 priority areas, such as research, education, direct-to-public communication, and public policy, so that these top-line recommendations will become the kind of the foundation of the action plan and then serve as a blueprint for the evolving brain health action plan for the decades to reach the 2050 national health future.
Let's wrap it up by trying to bring it down to earth. This is really lofty, big picture stuff. Can you give us some reasons why this might be important for the practicing neurologist? Are there any lessons here that could be applied in day-to-day practice?
As a stroke neurologist myself, I'm quite familiar with the concept of preventive care for our patients. But there is so much more to brain health than just vascular health, right? And I dream that one day we will be able to prevent most of the neurological disorders. And for those that we can't prevent really, we will have some secondary preventive strategies to optimize and mitigate brain health for those living with brain disorders. But I think right now, we have to be very pragmatic. In the future, we will figure out what a well-brain visit is going to look like for people of all ages. And one of the key priorities for us is to provide evidence-based brain health guidelines for that. So definitely stay tuned on that. And in the meanwhile, talk to your patients about brain health in general. Now you have the definition, you could kind of anchor around the definition for the conversations. Talk to your patients about the key components of brain health it may involve that we know about, whether it's a cognitive health, vascular health, whether it's some of the risk factors that can be mitigated. Talk about how important it is and why neurologists really care about brain health. Every ounce of prevention matters, and we can and should work with our colleagues in pediatrics and adolescent medicine and OBGYN and internal and family medicine and psychiatry and geriatrics and many more about the importance of brain health, and together we'll be making a difference in no time.
Well, thank you so much for your work and the committee's work on this important topic of brain health, and thanks for sharing this with us today, Natalia.
Thank you for having me.
This is Stacey Clardy, your podcast editor. If you've enjoyed the podcast, please take a few moments to subscribe, rate, and review the Neurology Podcast through Apple Podcasts, Google Podcasts, Spotify, or wherever you listen. And remember, you can always head to neurology.org/podcast for our full list of past episodes. Or you can also search by keyword in your podcast app for any neurology-specific topics you want to learn about.